how much of the state's budget goes toward public welfare programs. I'm Jill Horner. This is Comcast Newsmakers. With me is Pennsylvania State Representative Stephen Bloom. Thanks so much for being with us.
Thanks for having me, Jill.
Let's talk about the overall budget and the overall general fund. What percentage, what portion of it is going toward public welfare programs?
Today in Pennsylvania, we're spending on the order of about a third of the budget, somewhere in the 30 to 40% range on public welfare and human services programs. So it's consuming a great portion of our budget, and it's consuming more and more of the state budget on an annual basis. For example, if you go back over 10 years, the rate of spending increase on the public welfare, the dependency programs, has risen at 83%, drastically above the rate of inflation, and it continues to track in that direction. It's growing faster and faster every year, leaving less and less room for the other necessities of government. So it's becoming kind of reaching kind of a fiscal tipping point. We can't keep sustaining, the taxpayers of Pennsylvania can't sustain this rate of growth in the public welfare programs.
Is some of that increase a reflection of the recent downturn in the economy?
Part of that is, obviously, there are folks who may not have needed the public safety net in the past who now do, but even before the downturn, that rate was increasing all through the last 10 years. That rate has been increasing, and even in the decades before, it was continuing to increase through good times and bad. So there's something of a cycle of dependency that's arising that really is my biggest concern. Obviously, the programs are needed for down times in the economy, but when they're growing during the good times too, that's a bad sign.
Let's focus then on Medicaid. This is one of the programs that you're looking to address in terms of potential reforms. Talk to us first about the funding for this program, because this is not just funded through the state, this is also funded through the federal government.
Medicaid is a program that started back during the 1960s. It's a safety net for the health care needs of the indigent, the poor. And it's partially federally funded, and then the states also kick in a share of it. For example, under the Affordable Care Act, President Obama's health care law, there was a provision there that he actually wanted to see Medicaid grow at the state level at a tremendous rate, and if the states would kick in, the federal government would kick in. But the problem there is there's a thing they call maintenance of effort, that once you grow the Medicaid program on the state level, you basically really aren't allowed to shrink it back. And so it continues to grow. If the Affordable Care Act mandates were followed in Pennsylvania, for example, roughly 25% of Pennsylvania citizens would end up on Medicaid, a program designed for the indigent and the truly needy, and we would have a quarter of our population on Medicaid.
So what then do you see as potential alternatives? We've talked in the past about the idea of potential block granting.
Right.
What do you see as the purpose of block granting, and how could that work?
The idea of the block grant is, instead of just growing the program, which I don't think is a wise choice for Pennsylvanians, that's additional billions of dollars in taxpayer money we'd have to put into Medicaid. We could instead ask the federal government, and we're in the process of doing that, to grant us what's called a waiver, to allow us to block grant to allow them to pay us the lump sum. Then we can use innovative programs to actually increase the level of care that folks who are using the Medicaid benefits get, while actually saving money. Other states have gotten these kind of waivers. Florida has, they've done very well. Rhode Island has, they've done well. They've actually been able to save money and yet still give the people on Medicaid a better level of care, which is key.
All right, come back, give us an update. Many questions still
Big
yet
issue
to answer.
Dealing with over the next several years, yes.
Thanks
indeed.
for being with us.
Thank you, Jill.
We've been talking with Pennsylvania State Representative Stephen Bloom. I'm Jill Horner.